Welcome everyone to the 16th Asia Pacific Sociological Association Conference. This session is broadcasted live the Facebook page APSA Conference 2021 as seen on your screens. Again, the Facebook page is APSA Conference 2021. This year's conference follows the theme Solidarity and Collaboration Among Sociologists in the Asia Pacific towards resilience and inclusive development. We would like you to contribute to the sociological discussions here at APSA 2021. Please be guided of the house rules for today's session. All participants are automatically muted upon entry. The ceremony will be recorded for documentation purposes, and for panelists, please keep your video off and your microphone muted, especially if it is not your turn to speak. Also for panelists, we will warn you when you only have 3 minutes left. For attendees, please send your questions, specifying to whom it is addressed to the Q&A section at the bottom of your screen so that the session chairs can note this and raise it during our open forum. For those watching through the Facebook live stream, please send your questions through the comment box of the live stream. Let us now begin the webinar with a welcome message from the President of the Asia Pacific Sociological Association, Dr. Emma Porio.
Good morning, everyone. Welcome to the 16th Asia Pacific Sociological Association Conference. I would like to share with you that in 1996, the Philippine Sociological Society, with then President Cora Lamog, and the Philippine Social Science Council, with then the Executive Director Virginia Mirilao, organized the first APSA conference with the founding president, John Western, the legendary sociologist from Australia's Queensland University. Since then, APSA had been fortunate to be led by distinguished sociologists from Australia, Japan, Thailand, from Thailand and the Philippines. And we also have conferences in the cities of Southeast and East Asia. In the future, I'd like that APSA will have conferences in the cities of South, Central, West, and Pacific Asia. In 2012, we're very fortunate to host the APSA conference. The Department of Sociology, Institute of Philippine Culture of the Ateneo de Manila University, the Philippine Sociological Society, and the Philippine Social Science Council, who organized the 11th APSA conference with leading sociologists from Australia, Asia, and USA. We had Michael Borowoy, who was also keynoting the Philippine Sociological Society conference at the time. We had Michael Shao from Taiwan. We have Professor Surchai from Chiang Mai, Vinita Sinha from INUS, Professor Dang An from Vietnamese Academy of Social Science, and many others, and of course from the University of Sydney, Raywin Connell. So that was very exciting. We had plenty of leading sociologists from all over Asia and North America gathering and really promoting collaborative discourses and engagements among Asian sociologists. So I really hope that that kind of collaborative endeavor will continue in APSA. So in 2020, APSA President Miwako Hosoda, we decided to partner with 5 universities: Sydney University, Shisha University, University of the Philippines, Visayas, Chulalongkorn University, and the ADMU, and then 2 research divisions of the International Sociological Association, RC15, Medical Sociology, where Professor Miwako is also the president, and then RC46, Clinical Applied Sociology, which I happen also to lead. So this year, we are joined by Kyoto University and the Visayas State University. So I hope, as I was telling my colleagues in Mindanao University and Central Mindanao University and the Institute of Iligan Technology, I hope we can expand the family of university professors and their institutions, and sociological formations together. So this year, despite our teaching online and all these virtual engagements, we continue to engage, as engaged scholars and practitioners. We must continue to interrogate the key issues of our time, even though we are on a lockdown. Like, for example, the Philippines, we have been delivering our courses for the past, almost 2 years now. So, but despite that, we continue to relate and engage together in trying to look at the key issues of our time. So last year, I'd say in the 2020, and now also we have basically addressed what I call the twin crisis of our time: the climate crisis and the crisis of social inequality, which has been exacerbated by COVID-19 pandemic and the related community lockdowns. So these challenges, I think, have spurred creative and proactive responses among social and physical scientists, artists, in collaboration with their universities, local and national governments, civil society organizations, and community-based organizations. So in APSA now, I really hope that we continually create spaces for our creative and collaborative impetus for our theorizing, empiricizing, and analyzing, albeit in new forms, the dynamic forms that we interrogate what I call the existential crossroads of our time that has been brought by this crisis and the challenges of the COVID pandemic and the twin crisis of our time. So in closing, I'd like to thank our keynote speakers, session organizers, panel of reactors, and the organizing committee for their intellectual generosity and labor. Preparing, organizing conferences entails a lot of both intellectual, material labor. So I'd really like to thank, Professor Zakia, Professor Miwako, Professor Tess and Jessica, and of course, Joy, James, and Patty for, bringing this all together. I would like to thank also our Ateneo de Manila University President, Father Roberto Yap, and also the project holder of the Coastal Cities at Risk in the Philippines. The past 2 years, the Coastal Cities at Risk in the Philippines have been organizing the APSA conferences. I also would like basically to thank our chair, Professor Joel Canoday, and our School of Social Sciences Dean, Dr. Charina Saloma Aquedono, and also the President of the Philippine Sociological Society, Dr. Louis Ignacio, for supporting this gathering. So I would like to say that, these APSA conferences and our gathering together virtually during the COVID pandemic is really premised on trust, collegiality, and solidarity. And I hope that together we can contribute in a more collaborative world and a more better and dynamic world of sociologizing and interrogating the social issues of our time and opening and creating proactive responses as well as the alternatives that we may have a better future. Thank you very much. Joy? Yeah. Thank you, Michael. Okay. Joy?
Thank you, Dr. Porio.
Yeah.
We will now hear from the Ateneo de Manila University President, Father Roberto C. Yap, S.J., who is also the project holder of the Coastal Cities at Risk in the Philippines, Investing in Climate and Disaster Resilience Project.
On behalf of Ateneo de Manila University, I welcome you to the 16th Asia Pacific Sociological Association Conference. The theme of the 2021 conference, Solidarity and Collaboration Among Sociologists in Asia Pacific Towards Resilience and Inclusive Development, emphasizes the need for sociologists to consolidate their knowledge and expertise in order to contribute even more significantly to finding solutions to the world's most intractable problems. However, the complexity of these challenges, the global pandemic, climate change, gender equity, poverty and hunger, and so much more, demands that sociologists also collaborate with others beyond their discipline, with researchers and practitioners in science and technology, business and economics, governance and policy, and all other sectors of society. As the topics of this year's conference attest, this multidisciplinary collaboration is a distinctive strength of the Asia-Pacific Sociological Association. As sociologists, your research and insights in human social relationships and institutions are critical to the transformation and development of our society into one that is resilient and inclusive. May the additional knowledge and engagements that you will gain in this conference deepen your commitment and inspire you to continue your meaningful work for the advancement of humanity. I wish you a productive and enjoyable conference.
Now, we will hear from Dr. Melanie Robertson, the Senior Program Specialist of the Climate Change Program of the International Development Research Center in Canada, IDRC.
Good morning, everyone. My name is Melanie Robertson, and I'm a Senior Program Specialist at IDRC, the International Development Research Center. For people who don't know IDRC, we are part of Canada's foreign affairs and development efforts. We fund and support high-quality research all around the world. We share knowledge with researchers and policy makers to inform actions, and we also mobilize partnerships all around the world. First, I would like to thank Dr. Emma Porio for the invitation to say a few welcoming remarks today for the session, Climate Change, Equity, and Community Resilience. Combating climate change and inequalities are the main drivers behind our work at IDRC. And these guide our vision towards a more sustainable and inclusive world. Research is vital towards developing evidence-based solutions. I think everybody in the room will agree with this. However, for research to be successful, it must be needs-driven, solution-oriented, inclusive, and consider absolutely marginalized and vulnerable groups. Gender, ethnicity, socioeconomic status, age, and physical ability are all factors that influence how individuals experience climate change and adapt to its impacts. Although women, indigenous peoples, ethnic minorities, and people living in precarity contribute the least to climate change in terms of emissions, they suffer the most from its negative impacts. For climate action to be really effective, it must be based on research that help us to understand the interrelated climatic, environmental, cultural, social, economic, political factors that exacerbate the different impacts of climate change. We also need to really improve our understanding of how climate action can support social equity and enable everyone to increase their resilience and become positive agents of transformation. This is what brings you here today. I wish you a very great session, And thank you again, Emma, for this opportunity to say a few words on behalf of IDRC. This is an honor. Thank you.
Now, we will hear from Dr. Michael Burawoy, APSA advisor from the University of California, Berkeley.
Okay, thank you very much. Thanks, Emma, Dr. Porio, for your invitation to offer my remote welcome to the participants in your conference. I speak to you from Boston, USA, and these, we all know, all over the world are very difficult times, times in which the future of the planet itself is in balance, times when sociology has a crucial role to play, bringing hope by imagining alternative futures. But as sociologists, we have to understand both utopian possibilities, but also the constraints on those possibilities. Indeed, sociology is suspended between utopian and anti-utopian thinking. In these times, we need to draw on all the resources at our command, not least on the inspiration from the great sociologists of the past. In recent years, I've been inspired by the life and work of W.E.B. Du Bois, undoubtedly the greatest American sociologist. Also, in my view, the greatest public sociologist to have walked the planet. Born in 1868, just 3 years after the end of the US Civil War, he died in 1963 at the age of 96 in Ghana, self-exiled from the US. Why have we not heard more about him? Indeed. Although educated in the historically Black Fisk University, although he was the first Black PhD from Harvard, although he spent years at the University of Berlin, nonetheless, he was systematically excluded from established white universities and mainstream sociology, taking up a position at the Black Atlanta University. He developed his own Atlanta School of Sociology that preceded the Chicago School by 20 years, conducting research every bit as meticulous as the Chicagoans. Until recently, his enormous achievements were denied, but today we are increasingly turning to them. After 13 years of mounting frustration and racism, Du Bois left Atlanta University to found the NAACP, that is the National Association for the Advancement of Colored People, the famous civil rights organization, and became editor of its magazine, The Crisis, for 25 years, from 1910 to 1934. He showed how effective a resolute public sociology can be. He was not only an editor, but he continued to be a scholar, a poet, a novelist, and a dramatist. There were no limits to the ways he communicated his original sociology. Through most of his life, he saw the solution to social problems as a form of democratic socialism. But that itself, he always insisted, depending on first solving the race problem. At the turn of the 20th century, he proclaimed the color line as defining the future. This led him to being a leading Pan-Africanist. It led him to see how the US imperialism was thwarting the freedom of the darker races throughout the world. And his ideas stretched beyond Africa to Asia too. After World War II, he was a leader of the international peace movement, which put him on the wrong side of the Cold War, at least on the wrong side as far as the US state was concerned. He was indicted by the US state as an undeclared foreign agent, but the case had ultimately to be thrown out. He was embraced by the Soviet Union and China as a celebrated opponent of the US state and a determined advocate of civil rights. He lived the last years of his long life in self-exile in newly independent Ghana at the invitation of President Kwame Nkrumah. US mainstream sociology made every effort to bury his extraordinary contributions, in particular his reinterpretation of US history an reinterpretation that centered the role of African Americans, even as they faced assaults on their existence. US sociology disparaged his genius because it didn't want to be linked to his radical politics, politics that are now inspiring a rethinking of the past and the present, and indeed the future. Today, we need such global figures to inspire reconnections across the face of our devastated planet, reconnections that will attempt to save humanity from the disasters it has created. The Asian Pacific Sociological Association is undertaking the important task of building an international community to address such entangled global problems as climate change, pandemics, and inequality. Congratulations to Dr. Porio and her colleagues for mounting this conference despite everything. Thank you very much.
Thank you, Michael. That was great. Yeah.
Thank you very much, Dr. Brawoy. Also, thank you to Dr. Robertson, Father Bobby, and Dr. Porio. We will have 2 sessions for the first day of the conference, one in the morning and one in the afternoon. The first session focuses on health and inequality. Professor Miwako Hosoda from Seisa University in Japan will moderate this session, together with Associate Professor Zakia Hossain from the University of Sydney in Australia. May I now hand over the floor to Professor Miwako Hosoda and Professor Zakia Hossain.
Thank you very much for your introduction. So now we are starting the session 1, the Sociology of Health. So I'm Miwako Hosoda from Seisa University in Japan. And co-organizer is Zakia Hossain from University of Sydney in Australia. So Zakia, please get started. Thank you.
Thank you, Miwako. Good morning from Philippines and good morning from Sydney, Australia as well. I welcome you all to the 16th Asia Pacific Sociological Association, this webinar, two-day webinar. And we are so honored and pleased to have so many of you are here with us. As you heard from Professor Miwako, Professor Emma Porio, the president of Asia Pacific Sociological Association, that this association was formed in 1996 in the Philippines, in here. And then this is our 25th years. We are so thankful to all of you that who are with us for last 25 years. We acknowledge your contribution. We acknowledge you are with us in our journey. Thank you so much, and we look forward to see you in our future journey as well. This session is about health and inequality, and in terms of the topic, solidarity and collaboration are fundamental in facing the challenges, the COVID world. The pandemic challenges individuals, families, and communities. Global health inequalities are widening. Sustainable development goals are challenged, and climate change and global pandemic making more double burden in our society. We are facing this and we are living in a new normal. In this session, experts in the fields are engaged in knowledge sharing and ideological exchange, which are driving force in managing the effect of pandemic and improving post-COVID social cohesion, social inclusion, and well-being. In this session, we have 4 speakers, and I would like to invite, the way I will be doing is we have Miwako with us, and I'll be presenting all these presenters, and Miwako is going to coordinate the reactor session as well as the Q&A. So I would like to introduce our speakers, Professor Imtiaz Ahmed, University of Dhaka from Bangladesh. In this session, he is going to talk about COVID-19 pandemic, mapping social engagement in Bangladesh. Before I give it to him, I would like to introduce him. Dr. Imtiaz Ahmed is a professor of international relations and director of Center for Genocide Studies in the University of Dhaka. He is also currently visiting professor in many universities in Asia and other universities. He has co-authored and authored number of books and edited 35 books, 12 monographs. Dr. Ahmed heads several national and international projects and published more than 120 research papers, scholarly articles in leading journals, and edited volumes. I would like to welcome Professor Imtiaz Ahmed to deliver his presentation.
Thank you. Thank you very much for that introduction. Greetings to all of you. Good earth to all of you, given the time zone. No idea. Hopefully everywhere is morning, but not necessarily. So good earth to all of you. I will need to share the screen. I hope I can get in. Okay, lovely. Looks like I can do that. Just give me a second.
Your screen is here. It's
Okay. Okay, I have 10 minutes, so I will be very short in my presentation. I start by saying that, humans are not only political or economic beings, they're also social and spiritual beings. And so there are different ways that we reproduce ourselves, and particularly when in times of crisis, some would pray, some would go into music, some would just sit down and contemplate. But above all, what you need is social resilience. And that is where data makes a difference. If you have quite what you call robust data, then what gets reduced is fear. And this is very, very important because as we know, way back in the 13th century, I think, or even earlier, Ibn Rushd pointed out that is ignorance which creates fear, but then fear creates intolerance, and intolerance creates violence. So fear is something that comes with crisis, and with pandemic, COVID and pandemic, fear immediately got into the world, and of course also in Bangladesh. So very early on in March, when the pandemic hit Bangladesh, we got into the business of mapping the social engagement, and that again in Bangladesh, so that we would know what is going on, and mainly, as I said, to see several things in the society, so that people would be comfortable of the new situation that has come up. So I will go, very quickly to give you some sense of the mapping, but it's available also in our website. We mainly map violence in 26 categories. We have been doing it for last 3.5 years. We have nearly probably the largest data on violence in Bangladesh, nearly 10 years of data. So it was easy for us to do it. Methodologically speaking, it was not difficult. So some of the areas that we did, we wanted to see from the beginning the kind of protest that was taking place during the pandemic, and immediately know what are the reasons. So bulk of the protests took place, as you can see in the slide, over lockdown rules, for accountability, against proposed budget, against hike in bus fare, etc. And also you can know some of other areas. For example, there were protests against layoff, closures. So overall, the policymakers, when they see, and I remember very early on, by April or by May, I think, even governmental agencies got into our data to see what was happening at the social, to the society, so that they could also frame their policies accordingly. Rumors was the other thing that went up in different areas, and you can see in Dhaka it was really high, I guess, because of the city. You need city to get rumors, and the concentration of mobile phones also. So you get an idea, and you also get an idea where rumors was less. So that was one thing also we mapped. We also mapped fine, penalty, and punishment, and also the trend. In all those things, we had the trends, and you can see, fine, penalty, punishment in the beginning, there was a little bit up way back in April last year, but then it really went up in the month of August here. And the reason, well, now one can easily see the reason, and it was because of the semi-hard lockdown. It's very difficult to do a lockdown in Bangladesh. Nearly 90% is informal sector. So we have been flagging this, that you can't do hard lockdown. It doesn't make any sense, because when you have a very large informal sector, what it means that every day you have to, survive. So I guess one of the reasons it went up, the government tried a little bit of doing a semi-hard lockdown, but I guess they ended up with more fine, penalty, and punishment. We also mapped fear, and you can see it was really up when the pandemic started way back in March last year, and then in the midway it started down, and then when the second wave came, it went up. So you have an understanding of humans in response to the pandemic. Resilience was also something that we mapped, and interestingly, we found the bulk of the resilience came from voluntary work, individuals helping other individuals. That was almost 29.3%. If you look at the political, helping resilience is only 10%. And that also shows that the political parties did not do as much, people would expect them to do. University was even lower, is 4.9%. Private firms came a little bit up, and NGOs, but also not as much as the voluntary work. And of course, the law enforcement and local government also played an important role. Domestic violence was also something was very important. We needed to, this was something that we need to see how it went up. If you look at the death figure, which is the red color, you can see at one point it really went up a little bit, and then it came down. Bangladesh, I would say, to some extent, almost defied the global pattern, because the global pattern really showed it went up, up, up. But here we had an ups and down. Incident went up really in September, October 2020, but then it got down to August. If you compare, as we can compare, last 5 years or even last 10 years, it's not that, the difference was not that much. So that also helped the policymakers in many ways. Sexual assault, this is also interesting. The death figure remained relatively low, or relatively same, I would say. There was 100 deaths in 20 months, but you can see the injury really went up. Very quickly, on the violence against children, that also went up in the same period when the sexual assault went up. This is very interesting kind of a trend. The death also, violence against children, 637 in 20 months. We also map Rohingya. As you know, we have 1.1 million Rohingyas, which is a bigger population than Bhutan. Well, Bhutan took 60,000 years probably to become Bhutan, but this Bhutan inside Bangladesh became in 3 months. It's a larger population even than Maldives and Bhutan, so you can see people were really worried. But there too, in 20 months, we had 113 deaths, which would say that it was relatively, well, any death is really bad, but if you compare the data with New York or Detroit or Chicago, believe it or not, New York is much more violent, much more, even Chicago would be much more, or Detroit would be much more violent than Rohingya camp violence. So this was also something that the policymakers really was looking into very closely. Suicide is something really went up. This, I think, is also a global pattern. I was looking into a figure of Japan. There too, I think it went up. This is something that really worried people. Particularly if you look at the death and the incident almost were together. So whenever you had one incident, it ended up death, hardly survived. And the sources were, when it comes to mapping the COVID-19, 25 sources, but then we also map, as I said, violence all through. Now, what it does is, it helps you to, I would say, to reflect on the society as how they are responding to COVID-19. And for us, we could, this is part of the mapping, but the reports that came up very early on, we said that, the impact is not as bad as you see in some of the developed countries. Bangladesh is managing pretty well, and we could open up the economy, even the formal economy. I remember writing a piece in April last year, and telling precisely what I'm saying now, that we can actually, if we can keep three things in our hand: what is wearing mask, one, number two, hand washing, and number three, physical distance. If we can maintain these three things, we can even open up factories and industries. And that precisely, I guess, took place in one way or other, not necessarily because of the data that we were producing, but as I said, the data was looked into the policymakers very, very closely. And since the media, the print media also flagged all the data that we're producing in the beginning every week, and then when things slowed down every 2 weeks, it also showed that the fear that came up very early on was not there. But let me stop here. I think I've done my 10 minutes, but if you have any questions at the end, I can definitely come back. Thank you very much.
Thank you, Professor Imtiaz Ahmed, for your valuable presentation. This is very, very important for this COVID situation. And the data you have presented and all the information, that is quite amazing. Like, it is difficult to collect all this information, and you have presented so nicely. Thank you so much. I would like to do the question and answer session after all our presentation is done. And then we can, if you have questions, please keep that with you. And when we finish our presentation, you can let us know which question and who you are going to ask. Would that be okay? So I would like to start asking Professor Miwako Hosoda, who is the second speaker. And her topic is vaccine inequality and human rights in the era of COVID-19 and beyond. And I would like to introduce you, Professor Miwako, here with a short introduction. Professor Miwako is a professor of Seisa University in Japan, and she graduated from the Department of Sociology in Tokyo University and did a master's and PhD from the Tokyo University as well. She studied at Columbia University and Harvard University of Public Health. She is the vice president of the Asia Pacific Sociological Association, and she was our former president of this association, last one. And she is also the president of East Asia Sociological Association. And RN, she was also elected to be the board of the International Sociological Association, RC 15, Sociology of Health in 2010, and to the position of president in 2018. I hand over to Miwako, and over to you, Miwako, for your presentation.
Zakia, thank you very much for your introduction. So today I'd like to talk about the vaccine inequality and human rights in the era of COVID-19 and beyond. Please change the next slide. Next one, please. Thank you. So in the COVID-19 situation, no one is safe unless everybody is safe has become a common understanding. Until the development of the vaccine, prevention of COVID-19 infection was limited to preventive behaviors such as social distancing, hand washing, mask wearing, and urban lockdown, as well as symptomatic relief for infected individuals. Next slide, please. Eventually, vaccine was developed and prevention became possible. According to the WHO, vaccination is one of the most inexpensive interventions against infectious disease and is characterized by the fact that the target population can be set in advance and no lifestyle change are required. On the other hand, There are various problems that need to be considered, such as the side effect of vaccine, the availability of vaccine, and the fairness of access. We can see the two major issues related to vaccines. There are the issue of fairness in vaccine distribution in the global world and the issue of mandatory vaccination versus individual freedom. In this presentation, I'd like to raise these controversial issues to vaccine equality and human rights in the era of COVID-19 and discuss this topic with participants. Next slide, please. In terms of the vaccine equality, there are COVAX. This is an international framework for high and middle income countries to jointly purchase COVID-19 vaccine and distribute them free and charge to developing countries. It is led by WHO in cooperation with the Gavi Vaccine Alliance, an international organization that promotes the spread of vaccine in developing countries, and the Coalition for Epidemic Preparedness Innovations, CEPI. More than 180 countries and regions are participating in this framework. Next slide, please. So I'd like to share the COVAX framework. Can you please use the video if possible? So if it's not, okay, so there are some video I like to explain COVAX. So please visit the website of WHO COVAX frame. So next slide, please. The COVAX framework and other measures have improved vaccine coverage worldwide. This is a world map of vaccination as of October 2nd, 2021. More than 6.3 billion doses have been administered, enough to fully vaccinate 41% of global population. Please see the area colored green, where 60% and up population are already vaccinated the first dose. At the mid-October 2021, 55% of Asia people had been injected with at least one dose, while 39% had received second one. The vaccination rate for COVID-19 in Japan, for example, is 78% for the first dose and 74% for second dose. Next slide, please. As the COVID-19 vaccine became more available, some governments required their people to be vaccinated. Then another problem has arose. Many of civil groups around the world are opposed to vaccine mandatory and vaccine passport because of many reasons. Next slide, please. Some of the reasons are considered to be vaccine myth. So many government and medical institutions are scrambling to make people know the myth and realities about vaccine. Medicine has both sides of science and art. Sometimes the view of experts can be uncertain. It is also necessary to endure uncertainty. Can we withstand the medical uncertainty? Each individual should make independent judgment by referring to expert-owned, obtain health literacy and media literacy. Next slide, please. In the US and Singapore, vaccine record, such a vaccine passport, are now required to be presented not only the airport, but also the restaurant, shopping centers, and many other places. At such time, people who cannot be vaccinated for health reasons or who have psychological fear about vaccines may be excluded and discriminated against. From the perspective of equality and human rights, we will need to avoid this kind of discrimination. Next slide, please. People who avoid vaccination for various reasons, including concern about adverse reaction, are worried. Against the backdrop of the nationwide problem of vaccine harassment, in which people are treated unfairly in the workplace because they have not been vaccinated. Some people are saying that the right not to be vaccinated should be understood. In order to prevent infection, it is important for those around us to deepen our understanding of each individual situation. We do not force people who do not want to be vaccinated to get vaccinated. Vaccination is not given without the consent of the person receiving it. So it is necessary to force people at work or around. It is unnecessary to force people at work or around them to be vaccinated or to discriminate against them. A vaccine is not the only solution to the COVID-19 crisis, we should know, but a combined effort is still needed, including preventive action by people and improvement of the usual healthcare system. To achieve this, international collaboration and solidarity are necessary. So I'd like to talk with all participants how is the better way to overcome this pandemic crisis for currently and in the future. Thank you for your attention. So I'll get back to Zakia. Thanks.
Thank you very much, Professor Miwako Hosoda. Thank you so much for your beautiful presentation. And very, very important thing that we are talking here is the vaccination, equality, and human rights. And we do not focus much on the human rights issues. Your presentation highlighted some of the key areas that needs to be considered when we talk about the vaccination and its implementation. We'll hear the question from the audience, and if you have a question, please keep it with you. We'll come back to you with the question. If you have a question for Professor Miwako Hosoda, please keep it, then we'll come back and we'll have that session. And now in our program, we have the next presentation is basically from me. So I would like to have my presentation. And I just wanted to give you a little bit background of myself. I'm an associate professor in the School of Health, School of Medicine and Health, University of Sydney. I did my bachelor degree honors and MA from the University of Dhaka. Then I did my master's from Australian National University and a PhD from University of Queensland, Australia. I'm a recipient of a few awards, and also I have been chief investigator of quite a few international and national grants and published widely in the journal, peer-reviewed journal, also have many book chapters. I'm the founding secretary of this association in 1996 when the association was formed, and I came back again, and now I'm the secretary of this association. And my research is basically on women's health, breast cancer, cervical cancer, quality of life, and also inequality and resource limited countries. This is about me. So I'd like to have my presentation. Are you going to share my presentation slides? Jaya? Okay. My topic is diversity and inclusion, COVID-19 impact on socially disadvantaged groups in Australia. Next slide, please. So I'll be focusing on talking about the socially disadvantaged linguistically diverse groups as well. When we talk about socially disadvantaged groups, basically we talk about people who are disadvantaged because of their race, because of their ethnicity, class, gender, and their life chances and their opportunities are often affected by that. Disadvantage can lead to exclusion from society. Also have limited, they will have limited access to economic activities, as well as goods and services and resources and all activities. So these people are, sometimes we see them in the lower socioeconomic status standing. And we have culturally and linguistically diverse background population, and they are the one with a culturally and linguistically diverse group. That's what we are meaning here, called and socially disadvantaged group. Next slide, please. As you know, we are facing this global pandemic. This is worldwide global pandemic. It started in 2020, and the figures are keep changing. If we look at this world map, what it's showing is darker color showing where the highest prevalence and incidence of and also the highest death rate. World today is 251,788,329 cases and 5,077,907 deaths. If you look at Australia, Australia's death rate is quite low, and the color is very light, 181,578. So if you look at this, it shows that disproportionately COVID-19 has been impacted in many parts of the world. America has the highest incidence, highest cases, like 94 million, and Europe is 80 million. If you look at Southeast Asia, 44 million, and Eastern Mediterranean is 16 million. Next slide, please. So here we have got Australian figures. It shows in Australia there are different, if we look at this on the left-hand side, that shows the current figure of Australia and its death and the current cases. 140 is the people who are in ICU. 836 is in the hospital, hospitalization. And then if you look at on the right-hand side, this is the area where you can see that the different states has got different number. Queensland, and then we have the New South Wales and Victoria has the highest. And the median age of COVID cases is 30 years, and the median age of death is 83 years. So there are gender differences in terms of cases and infection, as well as in terms of the death, the mortality. Next, I think I would like to also show here in the middle that here, the number of cases that has been increasing this year, like in June, July to until now, quite a lot. Here it shows the number of people infected by age group and gender. You can see that younger group are more affected. In this one, it is more likely that older people, the death rate is in here. So it's more deaths are in the older age group. Next slide, please. So it's again coming back to this, it shows that evidence shows that more younger people are affected by COVID-19. And you can see the gender difference in here. Female are more likely to be impacted at a young age. And gradually, if you look at the deaths are more among the older people, as I mentioned earlier. And there are gender differences, more deaths among male. So it is really good to see that the inequalities in terms of cases and infection, as well as in terms of deaths, are there by age group. Next slide, please. This research is based on a secondary sources of data. I'll go back to that point. When you talk about cold community, a multicultural Australia, Australia is a multicultural society. We have about last census shows that 28% of people are from culturally diverse backgrounds. Shows it's about a third, like 30%. 300 separate ethnic groups are in Australia, and they are all 300 separate languages they speak. In 2016, the last census shows that 1/5 of Australian people language other than English at home. So this is really important to know that cultural differences are quite increasing, and it's important to understand Australia's health and inequality. And 3.3% are Australian Aboriginal population in the Australian population. And next slide, please. So this the presentation is based on a secondary sources of data. Primary data collection is still, it couldn't be done yet. So we are basing on all the published materials and the data. It shows that I'm going to use some examples that inequalities in terms of in the socially disadvantaged group. And looking at the global pandemic, you can see that disproportionately it affects the health and social well-being of vulnerable communities. And most recent study shows that migrant workers are more likely to be the most vulnerable groups. In the pandemic, we see that evidence from UK showing that those who are living in the poverty, overcrowding housing, low education, and inadequate access to health services, they are the one who experience high level of COVID infection, and they have more poor outcome, that means high level of death. Unique condition actually for the socially disadvantaged group, and because they have language barriers and there are prejudice and discrimination as well. And we can see that racism are there, and this happens to certain ethnic groups. It is more among certain ethnic groups. And there are limited access to available services because of these, their barriers. And those with the low access, they are the ones who are more likely to experience psychological distress and social isolation. And this situation is more worse when we see that lockdown is there. Excess mortality happens in certain ethnic groups, and the data shows that Black, Asian, and minority ethnic groups are the ones who are more likely to experience this high level of excess deaths. And it's Asian background, these are the communities are more likely to experience this risk of high level of deaths. Next slide, please. Some example from Australia, we can see that coal communities in Australia are more affected, those who are living in the hotspot areas, and those are the areas where the more concentration is from a socially disadvantaged group. Class, ethnicity, religion, culture, and language barrier, we already mentioned about that, that is exacerbated these differences. And some industry people are experiencing more losing their job, and more people in these industries will be, they're more impacted. For example, aged care and hospitality areas. And we see most of these workers are from socially disadvantaged group or the culturally, linguistically diverse background population. Temporary migrant, they are the more vulnerable, and they also experience some of the job losses, because job losses happens in those industries where they employ more, migrant community. Report also shows that early quarter, like 23% of temporary migrant experienced verbal abuses. And I also mentioned that some abuses happens to specific communities, for example, Chinese group, East Asian background communities. And the presence of racism and discriminations are there, and this that is really important to understand the inequalities and exclusion, social exclusion. Next slide, please. So some more example from Australia is about that other issues, for example, coal community crisis, more complicated when you see that migrant communities have restriction on mobility during the lockdown period. They have less access to the services because of the language barrier. We see some of these services they used with the use of interpreter services, and because of the lockdown situation, and these services are limited and they had limited access. Therefore, that has more impact on their physical as well as mental health. During the vaccination rollout period, we see that coal communities remain a critical frontier for a coal community's lack of literacy, and that has had some impact on the vaccination enrollment and vaccination completion. Coal women are more also affected by these global challenges, and we see that women are more likely to experience some of these service provision because they have less access to those. And some of these services, for example, sexuality and reproductive health, mental health, and occupational health, here are the women are more likely to lose the employment, and because of the restriction they have it has impact on their reproductive health. And many women also experience some domestic violence as well. Thank you so much. Next slide, please. So from all these things, we can clearly see that social exclusion and the social diversity and exclusion are very important in this COVID world. And we already have these inequalities, and COVID has made more challenges for these communities in terms of accessing services and in terms of using the services. And therefore, there is a sense of belonging, social inclusion, and citizenship. These are very, very, very much impacted. So in this session, we are talking about solidarity. We are talking about collaboration. Therefore, it is important to have a multidisciplinary approach, and responsible, transparent, and migrant inclusive public information strategies are very, very important. So we would like to say that strategies should include regular, accurate, and linguistically and culturally appropriate public communication and information sharing alongside community mobilization. Confronting racism and prejudice with a zero tolerance approach should be the core of government and social action. And this is also, we are looking here that this is not only in Australia, it is a global phenomenon. This sort of initiative, these sort of situations are also existing in other countries. So we need to see that we are doing collaborative research, collaborative action, and international programs are there to minimize this exclusion, and inclusion is there, and citizenship are respected. Thank you so much. And that's from my presentation. Thank you for listening. And again, if you have any question, anything, please keep it with you, and we'll come back to that after our next presentation. Thank you, everyone. If you have any questions, just keep it with you and let us know. Our next presentation is from Habibul Haq Khandekar. And I hear that his presentation I have to share, I think. Have you got his presentation, or shall I share?
I can share it.
Okay, that will be good. Let me introduce you. Professor Khandekar Habibul Haq is a professor of social science at Zayed University, United Arab Emirates, and a co-chair of RC9, Social Transformation and Sociology of Development, ISA. He is a co-author with Brian Turner, Globalization East, and he co-authored Asia, Europe in Globalization. So many books he has written, and this year his areas of focus is globalization. So he's an expert in that area. So I would like to thank you, Professor Khandekar Habibul Haq, and would like to request you to deliver your presentation. Over to you.
Okay, good morning, everyone. It's very early morning in Abu Dhabi, and thank you for having me on this very important conference. This is my first time I'm in APSA. I've always been interested in taking part, and finally it has worked. So I really want to thank the organizers for having me on board. So the paper that I have, and as I look at the watch, don't have much time. I call it, how does sociology as a discipline, or how do sociologists look at and have addressed this pandemic? So that's the main question that I have raised here. And then towards the end, I argue that sociology has to expand its horizon to include humanity, and it kind of dovetails with what Michael Buroway just said, that he also used that word humanity. It also came out in the president's remark, President Yap's remark. So, we can define virus in various ways, but this is a very unique virus. I looked at some historical precedents, and there's a new book called Apollo's Arrow, where it has been discussed quite extensively, the history of past pandemics and why this particular pandemic is so unique. And now, as you can see, the consensus is building that this pandemic is going to transform itself into an endemic, and we have to live with it. I mean, this is the latest scientific consensus that I have seen. So we're not going to overcome it the way, in the past pandemics have been overcome. This would be more like an influenza. This would stay with us. And it kind of makes scientists somewhat humbler, that we really don't know what's going on. I mean, that's another consensus. So in that context, how can sociologists play a role? What is their role? We tried to do this book, it has just come out this year, where we included like 20 plus countries and what's going on in different countries. Mostly sociologists were invited, and we did a rather comprehensive work. But this is like the pandemic is a work in progress. So we had to stop at a certain point, and we didn't quite cover the vaccine issue that was presented by Professor Hosoda. So this is a work in progress. We really need to continue our work. And when we look at sociology, I would say that there are a number of reasons why sociologists, I put it 3 reasons, but there could be more, that sociology presents with, it has an inbuilt holistic view or approach to society. And I think that's quite handy when it comes to a complex crisis like pandemic, because there's so many aspects to it. And therefore, sociology, my professor in Pittsburgh defined it as a science without a portfolio. So it really doesn't have a very specific territory to look at. So we can expand our horizon beyond the limited scope or the defined scope. We can go beyond that. This is what our discipline allows us to do. And there are certain subfields in sociology that are like disaster sociology, sociology of health, sociology of public health. I mean, they come very handy in dealing with research on pandemic. And finally, a group of social theorists, most notably Ulrich Beck, decades ago talked about risk society and how modern society, how modernity, or what you call second modernity, the reflexive modernity, has a tendency to produce crisis. So, I mean, these are to our advantage as a discipline. And then, of course, Michael Burrow mentioned, and Calhoun wrote some time ago, that we can bring in the insights of all the classical sociologists, including Burrow, that Michael pointed out. And then we can see, some of these social aspects like trust and social capital. We could exchange social capital with social resilience, as it came out in Professor Imtiaz's talk, that these things are extremely important, and we can judge their importance in times of crisis like pandemic. That if a society is equipped with social capital and trust, then it has a better chance of survival compared to societies, individualistic societies that we have seen in Europe and in America and in various other places, that how they're coping, in the midst of COVID crisis, they're debating about, vaccine mandate and so on. So we can see the role of social capital, and that's where sociologists can play an important role. And of course, as sociology moves on, we also have to pay attention to this trespassing of social sciences. And some of the recent works that I've looked at, especially Mariana Mazzucato and several others, who are focusing on a complete rethink of capitalism, the rethink of various interlinked crises, how economic crisis is intrinsically connected with climate crisis and how they're connected with pandemics. And this may not be the last pandemic that we are going to face. This is a dire prediction, but I I go with that. But then again, sociologists were not completely absent from the discussion. I found out that in 2019, Oxford Handbook of Global Studies, there was an essay on pandemics by a sociologist, Jacobson, based in Washington now. So we are not completely out of the radar. Sociologists have been involved. And when we look at, following Bourvet's recommendation and others, that sociology has certain advantages in terms of, our rethinking our discipline and returning to our classics. Auguste Comte and Kant, and in fact, Adam Smith, who can also be counted as one of the early sociologists, they all talked about not humanity in a direct sense, but Adam Smith had great things to say about altruism, about social responsibility. So we can return to our classical heritage and redefine sociology, not simply to look at national society. We have to broaden our approach to global society or humanity, because this is the term that is being frequently used in different discussions. And here I have a couple of references, not a comprehensive list of citations and references, but I'll be happy to answer more questions if I receive any. And I want to thank you for the time given to me. Thank you very much. Back to Zakia, please.
Thank you, Professor Habib Khondokar, and it was really good to hear that how sociology can, in this COVID situation, pandemic, how we as a sociologist can also think about sociology and the role, and bringing back to the theories what we had learned from our earlier classical sociologists. You mentioned about the classical heritage, Auguste Comte, and mentioned few of them. So I would like to say that it is really good to see that our panel has started talking about the engagement, mapping the engagement, talked about the vaccination and the human rights, and talk about the inequalities that in the socially disadvantaged group and how COVID has impacted. Now you brought the theoretical perspective of sociology in this context. And this is so good to see that we are talking about evidence and theories and how we analyze this pandemic. This is really great to see that all this, putting this together, this session is quite, nicely covered all aspects, almost all aspects of the sociology. Now I would like to say that let's, Miwako, and shall we do together the question and answer session? Let's see how many questions have we received for this session, and then we have few minutes for that, and then, sorry, then we'll go to the reactors and hear from them about their reaction to the papers. Let's do the question and answer session for a few minutes.
Thank you, Zakia. So we have several questions in the chat box. So
Okay.
could I ask the Professor Sang next Cho for your question? I believe we can take the question from the audience.
Yeah. I think I can see one question from the audience. Sung Nam Cho talks about the two Zakia and other presenters. I would like to hear more of impact of COVID-19 on mental well-being and psychology of people in general. Yes, definitely, it has a huge impact on people, particularly those with children and those elderly and those with some physical health problems. They are experiencing more psychological distress compared to any other group. So we have certain groups who are already vulnerable, and this situation has made them more worse. And in general, everybody is experiencing, like long period of lockdown in Australia. We can see that people are now experiencing different health issues like like anxiety, sleeping disorder, psychological distress, all of this. But I do not have exact evidence on giving you exact numbers, but these figures are coming and we know that this is happening. There are many articles that are talking about that. So yes, definitely it is happening, and it has a huge impact on psychological distress and mental well-being among all people, but certain groups are more likely to be impacted more. Those who have already their disability, already health problems, already they are distressed, already they have domestic violence issues, already there, it is aggravated, this situation.
Professor Zakia, I think Songnam Cho is raising her hand.
Okay, I cannot see the raising hand.
Yeah.
Okay, you want to say, Namcha, please, if you want to say something,
Nami,
please.
yeah.
Okay. Well, I was not allowed to unmute until now, so I just, I mean, I cannot show my face either. But I have some questions, and I mean, all of your presentation were all excellent, and I've been learned a lot. And I mean, Zakia, you also mentioned something about the mental well-being of the people after, you know, as an impact of COVID.
Yeah.
I'm just wondering, I mean, wondering what kind of, you know, government policy or strategy to handle this mental well-being of this, you know, impact of COVID, and especially the impact on the family relations. And since, you know, we cannot allow to see the family if you are impacted in the, you know, COVID situation. So I like to hear more about the mental well-being of the, you know, the impact of the COVID on this mental well-being of each country's cases, how they handle, or what kind of strategy each country has. That's my question to you. Thank you very much.
Thank you very much. And I will not be able to talk about all countries, but I can say something about from Australia, that some of these things probably is applicable to other places as well. Like if we see that those who have got psychological problems, mental health issues, they are already using the services. And then the current COVID situation, lockdown situation, they are not seeing the professionals face to face, but there is a telemedicine, telehealth, that sort of supports are there. And people are encouraged to, you know, share using the networking and social media that to overcome this. And many groups formed during this COVID situation to be engaged. And from the government side, we see that government initiatives are to support people who are at risk. And there is an online support system. Even those who cannot go for a, for example, one example I can give you that exercise, physiotherapy appointment. If they cannot go, there is an online physiotherapy support is there. Similarly, we see that mental health situation, people, there are different organizations and they are the one who are providing services online. You don't have to go physically, and that way it is helping. The other thing is about the growing number of people are experiencing this, which is true, and we all acknowledge that. And loss of job, social isolation, and all these factors are contributing to these mental health issues. But government initiatives are also to address those who are at risk and who already have this problem. They already have the mental health problem. They are the kind of different professionals. They are getting more supports in that sense. I hope I could answer your question.
Zakia, kindly, you know, be careful with your movement, because they get recorded and it detracts from you what you're speaking. Thank you.
Okay, thank you.
Thank you very much, Zakia, for your answer. And thank you very much, Professor Songnam Cho, for the excellent question. So I'd like to ask Professor Imtiaz and Professor Habib about the situation in your country, and to the end, I would like to introduce about the Japanese situation. So, Professor Imtiaz, please.
Thank you very much. Well, I have to say that I am not, I'm not a sociologist to begin with. I'm an IR person, international relations, and not a health person also. But I understand, any crisis will have mental issues. It's not abnormal. In fact, it would be abnormal not to have any mental crisis. But I think it's too early to come to conclusions as to how we would like to contain them, because humans have this enormous capacity to innovate. And I've seen with my, the experience that I had, not only this crisis, we had equally a big crisis back in 71 when we had a genocide. And as a student, for class 9 student or a child, I saw how humans have the capacity to face crisis. And that, I think, gives us hope. So my take on the whole pandemic experience, as I always say to my students, that my education has always been 1971 and not the classical schools or the boardrooms. I got more educated from my experience back in 71, leaving my parents and going to India and sleeping on the pavement. That's the kind of education. So pandemic is also something that you get an extraordinary education. So I have two straight comments as to what will happen or how the post-pandemic situation would be. I see Professor Khandokar has pointed about the sociology to be the all-encompassing kind of a discipline. My take on the issue of disciplines is, I think we will see changes, and I use the word, I think we're moving to an era of post-discipline. Not multidiscipline, not interdiscipline. We are moving into an era of post-discipline. We are going beyond disciplines. And I think this particular platform also shows myself being an international relations person, joining with the sociologists in a, what you call, in a slot on health, tells you that health is no longer an issue of public health. It's not only public health. It's as important for IR people when it comes to vaccine diplomacy and vaccine nationalism. That's where we work very closely. Even now, as you know, we are having a serious situation on the issue of vaccine nationalism. So what we will see is a post-discipline era. This is one take. The second one is, we are going to go beyond the traditional classroom. The classroom that came, it doesn't have a long history in any way. A room where you have classes. I think we are moving into D-class space, where classroom or D-class space would involve the students and faculty members from Philippines, from Nigeria, from Bangladesh, and maybe UAE, all together in a classroom. That will be the future where Miwako would be lecturing a group of students not in Japan but beyond Japan, and vice versa. This is going to happen. And what will happen with this? The students don't have to literally physically move to another country to get the best education or to get an education. Best is a always a problematic term, but to have an education. So we are moving in a direction where the faculty member, even within the country, if I speak in my university, that lecture, because of the technology, can be heard, and because of this whole experience that we have, can be heard in some remote areas in Bangladesh, which has already been the case. So you're not going to see these universities that came in 19th or 20th century, having kind of a structure, that I think is going to go in a different direction. And I think it would be much more exciting because you will have extraordinary people joining in from different parts of the world in the same kind of a time frame. So that I think is something that we need to see, and how that will produce knowledge is also something that I think we have to wait for. But I think we are into extraordinary times, and very, I'm very hopeful and not at all, depressed as some would say with the pandemic. I think the way we have overcome it could have been contained, but I'm not going to into that direction. It could have been contained, but because of the right-wing regimes in major countries, I think could not do it. Could not do it differently. But I'll stop here and wait if there are any other queries. Thank you.
Thank you very much for sharing your thought beyond COVID-19 as well. And so could you please talk about the mental health issues in the Arab countries that Professor Habibah?
On mental health, I was just reading that this was also a big issue in 1918-20 influenza pandemic. Mm-hmm. And in the state of New York, especially the city of New York, one doctor insisted on opening the schools using this mental well-being issue, that if we allow students to come back, they can be educated on pandemic, and this would also take care of their mental well-being. Because if they're isolated from each other, confined to their homes, this has mental illness consequence. And it's very interesting that after 100 years, we are also debating the same issue, especially when decisions were being made about opening schools. And I'm in touch with some students from Bangladesh, and they're really happy that the university is now, going in-person class gradually. So the mental well-being issue is very important. It has been neglected so far, and we need to address that. And I'm glad to see that some policymakers have taken that into account in reopening universities, academic institutions. In our part of the world and where I live, it has not been a big issue because we started in-person class, blended learning, some classes in person, some classes, online. But I just wanted to make one brief point about, vaccine politics, and also what is quite redeeming, because at one level, I just saw that Africa, the continent of Africa has 17.5% of the world population, and it has received so far only 2.5% of the vaccines distributed worldwide. So we can see that regional and continental disparity. And at the same time, I just read that BioNTech, which actually invented the vaccine, BioNTech, organized by two Turkish immigrant families. Now, they have just pledged that next year they will have one production facility in Rwanda and one in Senegal. So these are the positive developments that make me helpful. I'm also not a pessimist. Thank you very much.
Thank you very much. So
Professor Miwako.
Yes.
Professor Miwako and Professor Zakia, I think there are raised hands.
Yeah, I can see that.
Yes, I see. So, but I just to respond to the first and the second, the questions from the chat box first. Maybe I believe we have another 1 hour, right?
Yes.
Yes. So I will just, answer the question from the chat box first, and then I will take a question from the participant who
from Jessica and from Mark.
Okay.
There are two people who raised their hand.
Yeah, I can see, but I would like to answer the question from the person who wrote the questions in the chat box first.
Okay.
Is it okay?
Yeah.
So now, I answer the question from the professor from Nam Cho about the mental health issues and the COVID-19 situation. So especially in Japan. So as the Professor Nami told, there's a severe impact from the COVID-19 to the mental health issues, especially the young women. The suicide rate of young women increased because of the COVID-19, and there's many reasons to be considered. So the one is the unstable position of the women in the labor market. So many of them are working in the part-time job, and under the COVID-19 situation, they lost the job and they don't have a hope for the future, and they got committed. They committed suicide under that situation. So, and also the Professor Imtiaz mentioned the student from the elementary school to the university, they also had mental health issues. There are the several surveys about all the student to ask the the mental health issues and anxiety. Almost the 60%, over 60% of the respondents told they have somehow the mental health issues, including anxiety. So to respond to the situation, the government, like a Minister of Education, continuously try to open the school when it was closed. But another issue happened. So the student, not only student, but also the teachers and the professor also afraid of opening the school. So there are no clear-cut answer how to respond to this kind of situation, but we need to discuss and exchange their opinion and their thought. It is really important under this situation. And so this is the very short answer to the Professor Nami. And then I saw the question from the chat box about the Tokyo Paralympic 2020 and the vaccine hesitancy. So as I made during my presentation, vaccine hesitancy and vaccine myth is spreaded all over the world, not especially in Japan. And so even in the Olympic, the occasion, not many, but some part of Japanese had hesitate to get vaccination. So the answer is not especially in Japan, but this kind of phenomena is happen in many countries. So now I think I answered the question from a chat box. So I'll take a question.
There's another one.
Director, yes.
There are two people who raised their hand. Jessica?
No, Professor Miwako.
Yes.
There's another question from Hadassah Espiridion. He said, when thinking positively, COVID-19 pandemic will end, how will sociologists in collaboration with other sectors be able to avoid future pandemics from happening? Thank you.
It's a wonderful question. So maybe I will ask the presenters. So first, Professor Imtiaz and Zakia, Professor Zakia and Professor Habdai. So the Professor Imtiaz, please.
I have to hear the question again. Please go ahead.
Please.
The question from Hadassah Espiridion to everyone. When thinking positively of COVID-19 pandemic, will it end? And how will sociologists in collaboration with the other sectors be able to avoid future pandemics from happening? I think Professor Habib talked about this, Professor Miwako. Yeah.
Okay. I got the question now. I don't think it will end. As I think Professor Kondakar also made that point clear. The virus will remain in one way or other. It's only that how you tame the virus. And that's where the vaccination would come. There will be from time to time. The virus will remain and will mutate. They co-live with human beings. We just have to understand that. It's not magic science. It's quite simple, and it can become pandemic if we fail to contain it very quickly. There were several virus mutations which ended up being epidemic and not pandemic because there was quick attention to it. This one also we could have contained, and this is the point that I didn't really want to, didn't flag at that particular time. We could have contained, but look at the global scenario, and this is where international relations and politics and global politics come. We had right-wing governments in all the major countries, whether USA, then of course in UK, in India, in Brazil, even in Japan, and all of them were very insular. Look at the United States. You had Donald Trump. Had in the early 2020, when WHO was raising the red flag, if the international body got together, they could have kept it as epidemic. Not necessarily it would have turned into pandemic, but somehow you had a president in the United States who did not believe in the whole vaccine thing. In the virus thing. He thought it was a hoax. India is the same situation. We have a very insular prime minister, and same in Brazil, and of course also in UK. So I think the point is here, it's important for human beings to understand that if you want to get serious on health issues, you need kind of regimes which will do it. Public health has been in a very miserable shape. There are countries which have faced better because of better public health system. It has led to do with the technology as such. You could have the finest hospitals in the world, but if your regime doesn't believe in the virus, then the finest hospitals would not solve the case, and that is precisely what has happened in bulk of the developed countries. So here we have a situation of bringing in politics at the center of our discourse, and that's why I'm saying the post-pandemic would be exciting, because if we learn anything from this pandemic is that disciplines do not have boundaries. We need to go beyond disciplines, and this is something that we need to work, and how we have to reinvent the curriculum, rewrite the curriculum, who would be, what are the literature that would be brought in. These are the things I think we now have to get busy with. So I see an exciting time coming in the future.
Thank you very much. So yeah, I totally agree with you. So next, so Professor Zakia, please.
Yeah, just thank you so much. I think this is a really important point that you have made, like how we can think about avoid the future pandemic and what sociologists can collaborate and do. I think looking into the pandemic, the lesson that we have learned, it's really important that it is not only for avoiding this sort of pandemic, it's avoiding any infectious health problems, any infectious disease, because we are experiencing pandemic. This COVID has gone extremely difficult, but we are experiencing infectious disease every now and then. And these practices that hand washing, keeping hygiene, avoid facing any other people, sneezing etiquette, so many things that we have learned and that can be applied to our daily life, then we can avoid other infectious diseases as well. So this sort of behavioral change, when you look at this, how we can modify, and in the curriculum, in the education, if we can include those, that these are the behavioral modification we can use and we can implement in our daily life, there is many ways we can avoid this sort of situation. And this infection do not have to be a pandemic. If we can address this, if we can look at that way. So as a sociologist, we love doing research, we love doing, collecting evidence, and evidence is the best way of suggesting what we should do, what we should not do. Because you and me, we can discuss so many things, but our evidence is the one that can help us to guide other people. Like, these are the research findings, these are what people are thinking, this is what their thoughts, let's put this together and make a policy. Like, this policy is education, health prevention, health promotion. So these are the things that we need to incorporate in our education, in our policy, health policy, as well as daily behavioral sort of things, behavioral change, behavior modification. So I think we can work together and bring these issues and put this together. And it's a global issue, and it should be a global initiative that we can talk about, that how behavioral change can be modified and can be implemented to avoid any infectious disease, not only COVID, any infectious disease. This is what I think.
Thank you, Zakia. So now the Professor Habib, please.
Yeah, I just wanted to add to the behavioral approach that Professor Zakia is suggesting to that institutional approach, because one of the things that came out very clearly in this pandemic, that politics trumped pandemic. Politics got the upper hand, because very few people in the West know and recognize that China shared the genomic sequence of this pandemic within weeks, within less than a week's time after they found out about the pandemic. And they have been blaming China for stonewalling and so on. But they don't realize that they shared the genomic sequence with the Western colleagues, and that's how we finally got a vaccine. The second issue, that funding has been withdrawn. Defunding has been a big problem in public health issues. Under Donald Trump, the CDC, American CDC, Center for Disease Control, had an affiliate, an expert working with Chinese CDC. And that expert was withdrawn on budgetary issues. It's unbelievable. It's simply unbelievable that these things were done. Now, what we need is massive injection of funding to build a robust global public health institution, which we do not have. World Health Organization is not the same as global public health initiatives. We do not have that. And what I found remarkable through my research, that both China and Korea has more hospital beds per capita than USA. So, I mean, this is really mind-boggling that rich countries, very advanced countries, have withdrawn funding, public funding from health services. So American public health is a scandal, and the crisis has revealed that. And globally, we are really at an infancy in terms of tackling the crisis. But at the same time, because of the sharing of information, of the genomic structure of the pandemic and so on, we had like 254 million cases, and we had almost 30 million recoveries. And the death figure, 5.1 million so far, which is an underestimate, because experts tell us it's 15 million. Even if we take 15 million, it's nowhere near the percentage of casualties in 1918 pandemic, and the historic pandemics were absolutely mind-boggling. Half the population in Europe died in the 14th century pandemic. So we have made progress, science has made progress, but at the same time, we have stumbling blocks, and the blocks are mostly political. So, the vaccine mandate issue in America, the vaxxers, the anti-vaccine sentiment in various parts of the world, vaccine inequity, these are all political issues. I mean, I have looked at the case of Taiwan, it's a victim of politics. Otherwise, they started so well, and then, their response failed in terms of vaccine. So there's so many issues that we can post-mortem right now as social scientists, as sociologists, where all these fields can collaborate with each other and redefine our field as public sociology, that sociologists need to talk to policymakers, need to put pressure on politicians to release funding for research, funding for public health, funding for well-being issues in a very comprehensive sense. And climate issue is a burning issue right now, and we're neglecting it because at the end of the day, the pandemic is a problem of environmental disorder, that we came so close to human being, the animal world. And this pandemic, this virus is a zootonic virus. And this sort of zootonic virus will endanger in the future. So we may see a transition right now that the COVID-19 pandemic is becoming an endemic that we have to live with. But we cannot rule out future incidents, future outbreak of more deadlier pandemics if we do not take care of our environment. That's all I want to say. Thank you.
Thank you very much, Professor Harris. So in conclusion, maybe the holistic and the multidisciplinary approach is very important, and our sociologists can contribute for this kind of the manner for the future issues. So now I'd like to take the question from the Professor Jessica Doctor and Mark Pitcherry. So please talk about your question.
Thank you very much, Dr. Miwako. I actually have two pressing questions, and it can be responded to by our panelists. One has to do with the question on the statement of Dr. Habib on the global justice that we need in this period of the pandemic. And if we've talked a lot about vaccination, but we have not explored, that there were also other alternative approaches to the vaccines that have been largely marginalized. And in fact, in many countries, there's a lot of vaccine resistance, not just because of mixed information, but there are really those who believe that there are natural processes, that can be utilized, to address this vaccine. So how do we address this from a sociological point of view? How do we address the issues of marginalization that fed into decision making on how we deal with this vaccine? How do we deal with this pandemic? I'm sorry, I wasn't able to turn on my video. But the second question that I have is related to my first question. But what are the approaches for social engineering? If you were to choose, in this pandemic, in this period of pandemic, what will be the first, what would be the first strategy that you would want to advocate for in terms of social reengineering, so that we do not facilitate rapid processes of transmission, but we also do not sacrifice, the need of people to be in touch with each other socially, physically, beyond cyberspace, because it's not really for people in the West, it might be very acceptable, but for countries like ours, for instance, that really like to be close to family members, friends, how do we give a balance to that? What strategy do you think will be most useful? Thank you. I'm
Thank you
sorry
very
for
much.
the, yeah.
Okay, thank
Thank
you for your questions. So I'll take another question from the Professor Mark Richie too. So could you please share your question?
Okay. Hello, good morning to all. Yeah. There was a mention of politics. So my questions are about political institutions or governance institutions. Okay, so the question is, how do you think the pandemic will affect the nature of institutions of governance? Will it strengthen states than international organizations? Will international organizations be at mercy of states, right, or sovereigns? Will it tighten or liberalize processes in the future? And how will such dynamics impact social movements and civil society? Could you give examples of possibilities based in your context? Thank you.
Thank you
Professor
very much for your
Miwako.
question. Yes, Zakia, what?
I think before the next round of answers, I think there is one question in the chat box.
Yes.
That you might, from, may I tell you the question of Lamberto Pilatan?
Yes, please.
He said, good morning, ma'am. Professor Syeda, Zakia, and Ma'am Miwako. How could we promote diversity and inclusion in our educational system at present in this time of COVID-19 pandemic? Thank you. That's all.
Thank you very much. Diversity education. Okay, so we have the 4 questions on the vaccine and social engineering and political and social movements aspect and the diversity in education. So who can answer? Who want to answer the questions? So please, Professor Habib, thank you.
No, sorry, I'm jumping into this because the issue of governance and the civil society issue are very, very important, as raised by Mark Ritchie. If you think about the traditional governance, which is very much based on nation state, and the pandemic has taught us, as you, Hosoda, told us that, that if there's pandemic in one place, we are not safe in any other place. So it has to be dealt with collectively. So what we need is collective governance. That governance is too important to be left alone with the national elites. So it has to be global, and global cooperation, global governance, automatically leads to what we call global civil society. So there has to be more engagement. And now we have the technology, now we have the means. What all we need is the will to use that means to foster that kind of global solidarity across national boundaries, solidarity among scientists, solidarity among sociologists, solidarity among public sociologists, public intellectuals, to put pressure on the government. And one of the economists that I quoted, Mariana Mazzucato, she has written on smart state. She said, we need state. At the end of the day, state is very important, but not the traditional state, a smart entrepreneurial state. And she has shown, she has documented with evidence that most of the so-called private initiatives, private entrepreneurship in America in terms of vaccine research are funded by public money. So state has a role, government has a role in taking ownership of this of these vaccines and ensure that they're distributed worldwide as soon as possible, because they funded the research. And this is something that we don't discuss publicly. So in many countries, government is funding research and private companies are benefiting. So in this model of neoliberal capitalism has to be challenged. And there the sociologists and public intellectuals can join hands and put pressure on their respective governments to take charge and foster global cooperation and global solidarity to fight climate crisis and future pandemics that are waiting on the corner. Thank you.
Thank you very much. So we have another question about the marginalization in vaccine injection and the social engineering and education. So somebody, yeah.
Shall I comment on
Yes, sure,
it
please.
is about the diversity and inclusion in education. I think there is this is a question that came from, let's see, who is the one?
The Mitan.
Yeah. And talking about this, if we look at the diversity and inclusion we talk about in the education sector, it's important to, as we mentioned, like because of the COVID, the diversity is expanding and social exclusion is happening more. So the way we can include inclusion and understand the diversity, it's very important that we make more communication, consistent communication, and also acknowledge and respect the diverse group and those who are from a culturally sensitive group. And looking at cultural sensitivity and understanding that, and then we can include in our education that we incorporate those sensitivity and we incorporate those. For example, like we also can look at the lesson plan, how we can incorporate these cultural sensitive issues, how we can address them. So the way we can do that is basically looking at the lesson plan, acknowledge the diverse group, acknowledge the sensitive issues, that COVID could be seen differently by different ethnic groups. And the way we are talking about social isolation, family is very important, as some of you already mentioned. In Asian countries, it is difficult to, having isolation, and what we can do, how we can approach that. And we also know that the resources that school in the education system, not everybody has got the access. And those students who do not have the access, how we can include them in our system, how we can have the inclusive education. So we need to come up with a strategy that can give opportunity to these students so that they can be involved in the education. They are not missing out because they do not have the resources. So the system must be acknowledging those limitations and then try to incorporate system where these students with limited resources, how we can help them and how we can include them in the system. So we are talking here continuous communication, talking here inclusion of all these sensitive issues in the curriculum, giving opportunities those who are socially disadvantaged, less opportunity to access to the resources they need. We have seen that everybody need computer, everybody need internet networking to continue with the online education and teaching. But how much that can be possible in many developing countries where these resources are limited? What would be the options? Whether shall we go with the shorter semester? There is different ways we are talking here, these challenges that education system is facing. So we need to look at whether the losses that has been there for the last 2 years, we couldn't have the face-to-face teaching, we had alternative, and how many people who are socially disadvantaged had access to those alternatives. So there are ways, and as a sociologist, I think we have a significant role to play to bring this social inclusion in the education system and talk about the diversity. I think this is what I was thinking.
Thank you very much. Yes, please.
Okay. I don't think the solutions are easy. I don't think we are going for easy solutions. I think problems would be enormous as we, end up what you call. I'm hopeful, but let me flag the problems. Modernity somehow has got into our head. And when we say modernity, it has come to be now at least very insular. There's a politics of insularity or politics of singularity, let's put it that way. And we reproduced it, in fact, almost unwittingly. I'll give you an example, and all the countries would have one national bird, one national animal, one national flower. That itself is problematic. Means why did we get into, engage ourselves in this modernity where you almost worship centrality, and that has created a serious problem in human beings. So you need to come out of it. Not that scholars have not really, scholars have reflected on it, whether it's Derrida or Foucault, and I would say Tagore long back pointed this out, even Gandhi, but nobody really thought about it in that way. So that's one part of it. We have to get this singularity mindset out of our head, and changing mindset is not easy. Believe it or not, it takes generations to change mindset. That's one part of it. The second part is look at the issue of democracy. It has ended up becoming electoral democracy. Now, electoral democracy, an election only has become what democracy is all about. But with electoral democracy, you can have Donald Trump. With electoral democracy, you can have Narendra Modi. Don't forget, even Hitler was elected, so was Mussolini. And so we need to reinvent democracy. So that's not an easy task. How do you reinvent an exercise which people got almost used to it and looks very liberal and looks very progressive? If you talk against election, immediately they will say, oh, okay, but what kind of system are you talking about? Are you, all for authoritarianism or etc.? So the point here is we need to reinvent a lot of concepts, a lot of things that we have taken for granted for years. And here education has to play a big role. So I don't think we have an easy way out. What I'm saying, the exciting part is it will, at least we know a little bit of the problems. So in resolving this, I think we need to go beyond disciplines. One, we need to go beyond nation state. That would be the other thing. So at the end of the day, I think it would be empowering each and every person. Now, to empower each and every person is not an easy task. So we have a big task ahead. But as I said, if it's a big task, it's much more exciting than going for a small task.
Thank you very much. I truly agree with the idea to collaborate with the, multidisciplinary people and globally and internationally. So we have two excellent discussants for this session. So the one is Professor Enfarsiho Abaya from University of Philippines, and the Professor Sarah Ilsan Habib from Dhaka University in Bangladesh. So the Professor Enfarsiho Abaya, please.
Good morning, everyone. Let me share screen. Wait a minute. So I must say at the outset that my comments are based largely from the abstracts that were given to me, plus a bit of a PDF file from Dr. Ahmed. So in short, I'd like you to understand that context. And my comments would revolve around some conceptual underpinnings of their presentation. I begin with Professor Conker. In his abstract, he argued, and I quote, that for sociology to deal with the crisis at the level of global humanity, sociology must abandon methodological nationalism and humanity-centric holistic perspective that sociology offers is likely to capture the public aspect of COVID-19 crisis in all its nuances and complexities. Such fascinating position. And I think genealogically, it relates quite well with an earlier thinking about the global made by Zakia and the notion of global inside the national. And I think at that time, that was in 2010, there was this concern about the global local nexus. And also, Professor Kodker, I think, and I surmise, might be implicitly acknowledging Professor Borawo's formulation of grounded globalization. And here I think there's really a need for us to understand the value of ethnography in order to locally ground our observations of the issues and issues surrounding the COVID crisis. And in anthropology, we do have a category called global health. And in fact, James and Covert made reference to Professor Borawo's persuasion with respect to the concept of the global in their article published in the Annual Review of Anthropology, titled Anthropology and Global Health. Their definition of global health may find resonance in Professor Kodler's stance with respect to the idea of global public health. According to James and Covert, global health is an area of research and practice that endeavors to link health, broadly conceived as a dynamic state that is essential resource for life and well-being, to assemblages of global processes, recognizing these assemblages as complex, diverse, temporarily unstable, contingent, and often contested or resisted at different social scales. This includes work that focuses on health inequalities, the distribution of resources intended to produce health and well-being, including science and technology, social identities related to health and biology, the development of local consequences of global health policy, the organization of health services, and the relationship of anthropogenic transformations in the biosphere of health. The ultimate goal of anthropological work in and of the global health is to reduce global health inequities and contribute to the development of sustainable and salutogenic sociocultural, political, and economic systems. This last point, I guess, speaks quite well to Professor Kondler's notion of humanity-centric, holistic perspective. And much of what was referred to in this definition would find resonance in the earlier discussion of the other presenters. Let me now move on to Professor Hosoda's paper. And this I would like to relate or further nuanced using the ideas of Fuentes embodied in his article, A Bioanthropological View of the COVID-19 Era, Midstream, Beyond Infection. In his view, I'm talking about Fuentes, he said, the virus is not the root, however. It is a participant in the system. If controlling the virus with a vaccine is the end goal of tackling COVID-19, then once that is achieved, there is no guarantee of impetus to address the variety of reasons why COVID-19 system could function as it does. The biology of the virus, the health and physiological dynamics of human populations, economic and healthcare systems, global transportation and communication processes, the extraction, handling, and use of animal resources for cultural and nutritional needs are all interconnected variables that make up the system enabling the emergence of COVID-19. In other words, a vaccine-centric approach is problematic. said further that, oh well. Moving on, let me now comment on Professor Hossain's paper. And in her abstract, Professor Hossain observed that there's evidence that suggests that the incidence of mortality of COVID-19 are strongly correlated with socioeconomic disadvantages. For example, Australian indigenous communities due mainly to unequal access to effective screening and follow-up treatment and higher prevalence of underlying medical comorbidities. I'd like to underline that. Medical comorbidities and socioeconomic disadvantages, because I think her observations would converse with the framing of COVID-19 as a syndemic.
Professor Abaya, excuse me.
Yes.
There's a request from the audience to maximize your slide so they can see it.
Oh, sorry.
Thank you. Sorry. Yeah, Irene Tanso's, writing in the chat.
All right. I'm sorry about that, Dr. Emma. I failed to do that. So I'm here suggesting, following some leads from medical anthropology, the importance of the concept of syndemic, to look at the COVID crisis in terms of the notion of syndemic. And here I am presenting to you the medical definition, which of course, qualitatively and politically quite different from the one espoused in social science. And this is the one by Meryl Singer, to whom this concept is attributed. He defined syndemic as the concentration and deleterious interaction of two or more disease and other health conditions in the population, which sort of recalls the observation of Professor Hossain about comorbidities, okay? Especially as a consequence of social inequality and the unjust exercise of power. And here we can empirically suggest, for example, issues of housing, poverty, marginalization, and so forth and so on. So these biological and social factors combine to, bring about those deleterious suffering, the social suffering that in this particular case, COVID has engendered. So next is the notion of structural violence. And I think the notion of structural violence is a central concept to allow us to make sense of these processes that we've been talking about, or issues that we've been talking about. And here, Paul Farmer, who is a medical anthropologist, medical doctor, defines structural violence as one way of describing social arrangements that put individuals and populations in harm's way. The arrangements are structural because they are embedded in the political and economic organization of our social world. They are violent because they cause injury to people. Neither culture nor pure individual will is at fault. Rather, historically given and often economically driven processes and forces conspire to constrain individual agency. So structural violence is visited upon all those whose social status denies them access to the fruits of scientific and social progress. And I think this particular notion would shed light on our understanding of the discourse on COVID crisis. And I think also this particular notion would render Professor Ahmed's attention some clarity about, for example, the idea of social engagements, mapping of social engagements like protests, rumors, down the line. And I think also that Professor Ahmed's presentation calls attention to some, I'd like to think maybe later the Professor Ahmed would react to this, the ethical issues involved in this whole practice of social engagement or social mapping of social engagements, which is a technology, I think, that is, would come in handy for policymakers, okay? And it is here where we probably can raise the issue of ethics and politics of policy making. I end up with these titles, or 3 articles that I thought might provide further impetus for critical explorations of COVID-19. The Syndemics and Structural Violence of COVID Pandemic by Meryl Singer and Barbara Rolko-Bauer. Casales, COVID-19. Can this crisis be transformative for global health? And lastly, Shamasunder et al.'s COVID-19 reveals weak health systems by design. We must make global health in this historic moment. On that point, thank you for paying attention.
Thank you very much, Professor Ifrasio. So I thank you for your wonderful comment. And next, Professor Sarah Irfan Habib from Dhaka University. Thank you, Professor Habib.
First of all, thank you very much for giving me the opportunity to say something about the presentations. And I feel honored to be here to make some comments on 4 valuable presentations. I'm just going to give a free lunch comments on the 4 presentations. Fortunately, 3 of the presenters are known to me as a colleague. So I will go one by one. First of all, Professor Imtiaz, he has been a founding director of the Center of Genocide Studies in Bangladesh. And he has done lots of academic and intellectual works, particularly in the history of emergence of Bangladesh. I congratulate him because he has taken an initiative to make a mapping of social variables which are directly related to COVID pandemic. So being a faculty of international relations, he has done some work on health sociology, obviously. And the variables he has identified, such as protest, rumors, penalty, fear, domestic violence, sexual assault, these variables very much fit with the area of health sociology. The thing is, in Bangladesh, we have faced lots of challenges due to COVID pandemic. The main reason was we had lack of preparations and we had ineffective healthcare planning to deal with this pandemic. Also, in Bangladesh, we have shortage of hospitals, healthcare capacity, lack of effective coordination among government policymakers. So he has identified those things. The basic issue is the COVID-19 has given us some directions to do more research in the area of sociology of health. For example, whether the governments have the economic and institutional capacities to handle such a pandemic. So this is a vital question. And this pandemic actually forces us to think about the reimagination of the concept of social. In this health session, we had lots of discussions, critical discussions, and some of the questions were very much powerful. I would say the questions are more powerful than COVID-19, but it is very difficult to answer in a shortcut way. One of the basic problems we see is the issue of medical socialization of physicians and frontline health workers. This is a big challenge in Bangladesh, and I would say this is a challenge for other countries as well. How to handle patients in this critical situation. Although a medical doctor or a healthcare worker has got some kinds of training in a medical setting, but COVID-19 has taught us the different kinds of dynamics and challenges. So medical socialization is very important. Unfortunately, in Bangladesh, as well as in other medical institutions, health sociology and medical sociology is not being taught. As a result of that, the mind setup and framework is very much confined and concentrated on virology, immunology, bacteriology. But COVID-19 is more than biology. This is very much important, and sociology has got lots of things to do. The second presenter, Dr. Zakia Hossain, she has made some valuable reviews in relation to social inequality in the context of Australia and United Kingdom. Mostly, she did some research on the culturally diverse groups in Sydney and found that these groups, these minority groups, their experiences or challenges are quite different. Obviously, social inequality is one of the factors, but minimizing the gap of social inequality is not the solution. There are lots of other issues. And one of the basic questions is whether it's the effect of biology, or it is the effect of culture, or it is the effect of social issues. Whether the genetic components of these migrant groups can make people more vulnerable, or whether the cultural patterns, lifestyles, and the structural barriers play a vital role for the vulnerability. And it is the question of agency and structure as well. So evidence has suggested that social inequality exists in the United Kingdom. It exists in Australia. It exists in the United States of America as well. And we have to look at the housing condition, the occupational risk, and the access of healthcare. So the basic issue is the richest societies or the richest countries in this world may not have the best healthcare system. And America is the best example. And COVID-19 has taught us that your per capita GDP is not the solution. The solution is how you handle this situation. What is your priority? So this is a nice presentation, I would say, in the context of Australia. And this is a presentation about the social and cultural factors. And as we know, many of the migrant groups, minority groups, they have other health problems as well, particularly the Asian people in the United Kingdom, the Afro-Americans, they suffer from chronic diseases, particularly coronary heart disease, hypertension. These are very much common among this ethnic group. So scientists, they are suggesting that whether these comorbidities were responsible for the high mortality during the COVID pandemic. The third presenter, Professor Habibul Haq Khandekar, he is a very renowned sociologist and he has been working in the area of globalization. He used to teach in Singapore National University. He made lots of valuable comments, and I'm happy to know that he has been working in the area of health as well. Sociology has many things to do with COVID-19. Particularly sociology and public health share many of the concerns in the study of social and cultural factors that actually affect health. Although sociology and public health have different approaches, methodological procedures, conceptualizations, as well as measurement and research designs, but often they serve for collaboration between the two disciplines. We are living in a situation in which we no longer predict or control the virus. There will be re-emergence of infectious diseases, and plague is the best example. As you can see, plague re-emerged in Bombay in the mid-90s. So COVID-19 is not the end in human society. One sociologist, Beck, has suggested that we are now facing the unintended consequences of industrial modernity. This was discussed in his famous book, Risk Society Towards a New Modernity. So there are lots of discourses of risk related to COVID-19, and this can be discussed in relation to the key concepts of sociology, such as risk, globalization, multinational cooperation, our consumption patterns, international trade, and health education as well. And some of the presenters, they have actually covered those issues. So public health and sociology actually share many of the same boundaries. Public health has got two focuses. One is the broad focus and the other one is the narrow focus. The broad focus actually addresses the structural issues, the socio-cultural foundations of health, in which sociology and public health are interrelated, in which sociology can work with COVID-19. The other one is the narrow approach, which actually focuses on the proximal risk factors, such as our lifestyle, our hand washing, the mask issues, social distancing, our risk behavior. So the structural issues can be done in a collaborative manner. So this is the area where sociology and public health can actually work. In many of the countries, we have seen that the healthcare system actually depends on the powerful interest of the politicians. As I have mentioned, that public health activities, these are actually not carried out in a social vacuum. They are subject to the powerful interest and the political economy of many countries, and Professor Khandekar has mentioned that. And public health has a long history of concerns with access and equity, and it is possessed with social justice dimension throughout the human history. So the basic issue is equity, accessibility, our appropriateness, our empowerment, integration of health services.
Thank you
In our-
very much. Thank you, Professor Sarah. So it's almost the time. I'm really appreciate your discussion. And again, thank you very much for all presenters and discussants for your excellent participation. What a wonderful session. All countries are responding to COVID-19 in various ways and working for international coordination. In addition to medical care, we are also trying to respond to the pandemic in the area of politics, economics, and media. In this context, contribution from sociology, such as those discussed in this session. This is also very important. I hope you will make use of what you have learned through this session in your own country in the future. Thank you again for your participation. This is the end of the session. Thank you very much.
Thank you, everyone, again.
Thank you.
Thank you very much, Professor
Yeah.
Miwako and
Thank you.
Professor Zakia for moderating the open forum in the first session of APSA Conference 2021. And with that, we end this morning's session of the 16th Asia Pacific Sociological Association Conference.